Now, the hormonal control of the female reproductive functions is a coordinated effort between the hypothalamus, anterior pituitary, and the ovaries. These hormones are responsible for the development, not only development, but maintenance of the female secondary sexual characteristics, and that are going to be maintained up until menopause. These hormones are also responsible for the maturation of the follicle and for the changes that occur during each cycle. The female sex hormones all start with the gonadotropin releasing hormone being released by the secreted by the hypothalamus, stimulating the anterior pituitary to make FSH and LH. Those two hormones are going to control the ovulation process, leading to the production of estrogen and progesterone by the ovaries. There are other structures that also secrete estrogen and progesterone, and those are the adrenal cortex and the placenta during pregnancy. So the placenta is also considered an endocrine gland. Now, for the functions of estrogens and progesterones, well, estrogens, and notice that it's plural because there are lots of different estrogens. This is kind of like an umbrella for different hormones that are collectively called as known as estrogens. So they all stimulate the growth and the enlargement of the secondary reproductive organs, stimulate the thickening of the endometrium, which is the innermost layer of the uterus, and they also help in the development and maintenance of the female sexual characteristics, like, for example, the enlargement and the development of the breast tissue, the increase in the amount of adipose tissue in certain areas of the body, for example, including the breast, the thighs, and in the buttocks area, and increase the blood vessel supply of the skin or increase vascularization of skin. The functions of progesterone, while they obviously also contribute to the changes that happen in the endometrium during the menstrual cycle, they also have a role in the development of the mammary glands, which are the glands of the breast tissue, and they help in the regulation of the gonadotropin secretions through negative feedback. Now, here you can see the whole process where the hypothalamus releases gonadotropin releasing hormone to stimulate the anterior pituitary to release FSH and LH. Now, FSH will reach the ovaries. Both of them, FSH stimulates the whole process of oogenesis, while LH, there's a sudden peak or sudden surge of the levels of LH in the bloodstream that leads to ovulation. Now that the ovaries are making estrogens, these estrogens are going to inhibit both the hypothalamus and the anterior pituitary from making too much of their hormones, and is obviously going to make changes, or systematic changes in the body. For example, development of the breast tissue, increased vascularization of the skin, increase in the adipose tissue in the different areas that we mentioned, the enlargement of the accessory reproductive organs, and thickening of the endometrium. Now, the menstrual cycle is a cycle that averages about 30 days, and we talk about it here in that kind of time span of 30 days, but it could be anywhere from 21 days all the way to maybe 40 days. It's very variable among women. So, but the average, in order to kind of be able to explain it, we will use that average of 30 days. It starts, or the very first cycle to start, the very first reproductive cycle is known as the menarche. Usually starts at the age of 12 to 13. Again, very variable depending on genetics, depending on ethnicity, and lots of different things that kind of go into it. But again, on average, about 12 to 13 years of age, and continues up until the late 40s or early 50s. Now, every single month, we know that one follicle is going to mature and is going to be ovulated. and the remaining of the follicle is going to change. It will close up and become what is known as the corpus luteum. In the absence of fertilization, so if fertilization does not happen, that luteum is going to degenerate. So is that oocyte that was fertilized. Both of those will degenerate, and that corpus luteum is now fibrous tissue and is known as the white body or the corpus albicans. So these are all of the hormonal control of the female sex characteristics. It's found in 2 slides. I am actually going to use this to explain how it goes, but feel free to read through that process as well. So this right here, these are the changes that happen in the ovary, while the bottom shows the changes that happen in the uterus. They obviously go hand in hand. This right here represents day 1 of the cycle, while all the way over here is the last day of the cycle. Day 1 means the day that bleeding started. Okay, so the very first day of bleeding is considered day 1 of the cycle. This line here represents day 14, where ovulation occurs. So let's take a look at the name of the phase that happens before ovulation. It is known as the follicular phase because the follicle is developing. So the levels of LH and FSH are rising, and that is going to stimulate the maturation of the follicle. This follicle is producing estrogen and progesterone, but as you can see here, the levels of estrogen are higher than the levels of progesterone. These hormonal levels produce changes in the uterus, in the endometrium of the uterus, and that is known as the proliferative phase, where there is proliferation of the endometrial lining and increasing in size and in the number of layers of the endometrium. So the follicular phase in the ovary corresponds to the proliferative phase and the menstrual phase. Again, the menstrual phase is that phase of bleeding, which is about, again, varies 3 to 5 to maybe 7 days, but here we're talking about it in the range of about 5 days. So this happens when the levels of estrogen and progesterone drop, meaning that the endometrium is going to die and be shed off, together with mucus and blood. And then as the follicle develops, levels of estrogen and progesterone get higher, and that will lead to the building up again of the endometrium. So the bleeding stops, and there's a proliferation of the endometrial lining. Again, follicular phase in the ovary corresponds to the menstrual and proliferative phases in the uterus. Then there's a surge or a sudden increase in the level of LH. That LH surge leads to ovulation. The remaining of the mature Graafian follicle becomes the corpus luteum and secretes mainly progesterone, but also some estrogen. Now, these hormones will circulate and reach the uterus, and leads to the increase in the vascularization, which are the blood vessels, and the glands. As you can see, the glands become deeper. The blood vessels are now engorged, and this phase in the uterus is known as the secretory phase. So the phase in the ovary that where the corpus luteum is made is known as the luteal phase, and because of all of the progesterone that is being made in the by the corpus luteum, it is leading to the secretory phase in the uterus. Now, if no fertilization happens, the corpus luteum degenerates and becomes the corpus albicans, which means that there is a drop in the levels of estrogen and progesterone that are being made by the ovaries. That leads to the death of all of these cells, and starting again the menstrual phase. So bleeding occurs with the shedding of the endometrial lining, including the secretions from the glands like mucus and, of course, the blood as well. And that's when the cycle just keeps on repeating itself. Now, we talked about male infertility, so let's discuss a little bit about female infertility. Infertility, generally speaking, is defined as the inability to conceive after 1 year of trying. So, having a couple saying that they weren't able to get pregnant after 6 months of trying is not considered infertility. You would advise them to complete trying until a year passes. You might want to get a good history about their sexual activities and about explaining when ovulation occurs and how to detect ovulation and so on, so that after 1 year of trying to conceive, if they are still unsuccessful, that would be considered infertility. Both male and female, they contribute equally to infertility, and about 25% of cases really is due to not just one factor but multiple factors. There are several cases or several reasons for female infertility. So these are just some of the examples, the more common ones. For example, anovulation, where there is no ovulation happening, and that is usually due to the hyposecretions of FSH and LH from the anterior pituitary gland. Endometriosis, which is a condition, it's actually a very painful condition, where the endometrial lining is not only on the inside of the uterus, but it is found dispersed in areas where it shouldn't be. For example, in the abdominal cavity, in the pelvic cavity, on the uterine tube, and so on. And because of these cells being endometrial tissue, they are going to they're being exposed to these estrogen and progesterone. All of the changes that happen in the uterus are also going to happen to these cells. So they increase in size, they increase in vascularization, they do die off and shed and lead to internal bleedings, just like the cyclic changes that happen in the endometrium found in the uterus. So you can see that this process can obviously lead to scarring, which could lead to infertility. Repetitive infections, sexually transmitted infections like gonorrhea, for example, can also lead to scarring, which can obstruct the uterine tube, preventing the sperms from reaching the egg. Or if fertilization occurs, it might lead to an ectopic pregnancy, where pregnancy happens outside of the uterus. Now, menopause is where the menstrual cycles stop. It usually happens in the late 40s or the early 50s. The ovaries are no longer able to produce estrogen and progesterone, and that's because they ran out of follicles. Some of the female secondary sexual characteristics tend to disappear because remember, those were maintained by estrogen and progesterone. Now that these two hormones are not being produced anymore at the same levels, well, those secondary characteristics are going to start to disappear. 50% of women that go through menopause experience hot flashes. Others experience maybe migraines, headaches, back pains, and fatigue. Some do not have experience any difficulties whatsoever. And this finishes this portion. The next part we will be discussing the breast tissue and mammary glands.